Welcome back to Taking Charge of My Cancer, episode 70. Joining me today is a very special guest, Kyle Schlock. So Kyle is a third-year PTA student at High Point University, completing a 12-week rotation here at UF Health at Med Plaza. He went to undergrad at the University of Colorado at Colorado Springs and graduated with a bachelor's degree in exercise science in 2022. After school, he is planning, 2020. After school, he's planning to pursue a career in orthopedic physical therapy. So Kyle, thank you so much for doing this with me today.
Yeah, thank you.
So he thinks he's going to pursue ortho, but I think I put a seed on his head about that he needs to be an oncology therapist. So let's see how it goes. We'll talk later in a few years and see what direction are you going. So like I always say to my students, my goal is to make every one of you oncology therapists or PT. So hopefully that's going to be happening. But you want to tell me a little bit about your role, and did you always planning to become a PT?
Yeah, so since high school, planned to go into something in the medical field, didn't really know where, thought maybe MD, thought chiropractic, thought PT. My mom had a surgery beginning of my freshman year in undergrad, and I went to a few of her PT appointments and ended up shadowing the PT there for a couple weeks, and that's kind of where I decided, changed all the focus towards going into PT at that point. So that's where it kind of started. And then my role over the last, I guess, 11 and a half weeks now, I have been your student here at Med Plaza, working with all the oncology population.
Okay. How was that for you? I know, many of you guys don't really have a lot of a background information about cancer and certainly oncology rehabilitation in a school, which hopefully things are changing a little bit now. I see more and more things happening on the curriculum, and even with your school, it's really cool things that happen that maybe other schools don't have, and we'll talk a little bit more about in a little bit. But you're coming, with a heavy background in orthopedics. So how, if you compare yourself, this is your last week here, 12 weeks later, 12 weeks ago when you came in on the first week, what were your thoughts when what made you decide to come to this to beginning with? And then what were your thoughts when you came in?
Yeah. So I always, going into school, wanted to do, as soon as I learned like oncology was a subspecialty for PT, I knew I wanted to do a rotation. I had an uncle pass away of colon and liver cancer. That's kind of what sparked me wanting to go into the medical field way back when. Um, so I always knew I wanted to do a rotation in an oncology setting. Um, but yeah, coming from orthopedics, I was a little bit nervous about kind of what we were going to see. But then, like you say it all the time, like you're just treating orthopedics. You just have a special flair of the oncology treatment coming into things, but really it's no different.
Yeah, that's exactly right. And do you feel that in your school you have enough of a oncology-based knowledge to make you feel well prepared for this internship, or you feel that they need to continue improving on their curriculum, some of that?
So our program, we get to take selective classes. I took a class on oncology that was taught by two board certified specialists. It was just for 2 weekends, kind of an intensive 8 hours for 4 days there. So that was a lot of information. Outside of that, like we get maybe 3 or 4 lectures through school that involve any sort of oncological diagnosis or anything like that. So I feel like without that second class that not everybody had to take, I feel like we get a little bit, but definitely not everything you would want to know coming into an oncology rotation or coming into um, looking for a career in treating the oncologic population, I feel like it was very baseline. This is kind of, I feel like also during school we learn like you can't do anything with anyone that has active cancer. Like all of this is don't do it, don't even think about it. And like being here, like none of that is really true. Like you can do anything with this population. So
Exactly. So you just need to have certain precautions with certain things, right? But like I always say to my students, and I even say to patients, right, when we have stage 4 type of cancers, and it's kind of like you then worry all about quality of life. Number one is no any research that shows any evidence that by doing manual therapy or doing manual lymphatic drainage or wrapping somebody, you're spreading the cancer, right? Or even
yeah,
the visceral mobilization, you're spreading the cancer. But if it's all about quality of life, even if it is no evidence, but let's pretend we are spreading the cancer, like who cares, right? It is all about quality of life. You're already stage 4. And then the whole idea, and that's what you have seen here with some of our stage 4 type of cancer patients, is like really help them to be and have a great quality of life until, that day comes and they're not here any longer. But in the meantime, the idea is to get them to do whatever they wanted to do, being careful in certain things and being aware of certain things, but certainly it's all about living life, right? Not being just afraid to do anything every day. So that's kind of the most important. So will you give me any valuable tips for patients with cancer and as well for students or even physical therapists who wants to pursue oncology?
yeah. So I'll start with kind of the student side. I feel like just through classes and everything, like try to delve in deeper to the population and what truly clinical practice looks like versus what we're taught out of a textbook, because they're very different um, in terms of just the physical therapist that's looking at joining a career. More so just there's not really a big difference between your other populations and what you're doing with an oncology population. um, they're very similar, and again you're just getting the flair of these medications and things that they're on, that you have to look out for certain things. And there's a lot of them and a lot of different side effects based on what they're on, but you have resources that you can easily find out, okay, they're on this, I know I need to look out for this. So honestly, just go for it if you're thinking about it. I feel like some of the patients that I've got to know and got to treat here have made a lasting impact on how I want to treat as a physical therapist in the future too. So and then just for anyone going through cancer treatment, I feel like the biggest thing is just stay active, even in the days where you don't feel like it. Just looking back at over the rotation, the patients that stayed active and didn't let those days where they didn't feel like doing anything kind of overrun their life. They seem to have better outcomes and a better quality of life in the long run too.
Yep, that's very good. How about a painful lesson that you learn along the way? Same thing as a student and as were you impacted by somebody here that you work with, from the cancer standpoint?
Yeah. Um, painful lesson along the way. I feel like probably that like you're especially with I like to have like a plan coming into the session, and I feel like with the oncology population more than orthopedics or neuro or anything else, like it is very much like you can't just plan on sticking to whatever you thought you were going to do coming into the session. It's gonna be you're gonna have sessions where maybe 3/4 of it is just talking to the patient and you have to kind of be okay with that and kind of okay with ditching what you had planned coming into the session. Um, yeah, I feel like that was the biggest lesson I learned, and then definitely have had patients that have left a mark on me. Especially like some of the younger patients that we see come in and like have their life turned upside down, um, or even some of the patients that come in with stage 4, just seeing their mind shift from when they're first diagnosed to coming in and really just blowing it off when they learn they have another met or anything like that.
Mhm.
um, just like seeing that and seeing like how I can get down on myself when something so small happens in my life, but these patients are going through this life altering
Yep.
thing in their life, and they're able to push through day to day.
Yep, 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 yep. So, and that's usually what I learn a lot through this journey with these patients is like, I like don't sweat the small stuff, right? Like, sometimes we complain about this and that, and yeah, I have this elbow pain and I have this, and it's like, oh my God, I have nothing in comparison to what a lot of patients out there really dealing with on a daily basis, and they fight in their life, right? So definitely change your life perspective. And I think this is why I love these populations so much, because they are like really all about, they're so rewarding. Like you tell them, and you have seen that, like they can be feeling like, so terrible because they just have chemo. And they're like, here, I have patients. I had a patient the other day who fell out of a ladder 2 days before she came. And I'm like, and you're here. You have somebody just passed away, a significant other, husband, whatever, and they're here. And it's
Yeah,
like, oh my God, like, because they just really feel how much we can help them to have that little light in the middle of this darkness that they go in dealing with this cancer. So that's it's really nice. So what do you mean to advocate for yourself, and how can people do that?
I feel like that's something I struggle with a lot of times. I feel like it's easy to advocate for other people, but when it comes to yourself, it's not always the easiest thing to do. So something I've tried to get better at, but I think just just doing your research and knowing what's best and not letting someone just because they have MD or anything behind their name dictate kind of what you want. Like we have seen that, I know with some of the patients that we've seen here, that doctors are like, "Oh, this is what you need." It's your life. Like if you don't want this massive surgery or this certain drug or anything, like it's your life. You're the one that gets to make the decisions for it. So really just staying up to date on what the risks are and everything, but also if it's something that you don't want, like don't don't be kind of coerced into doing something.
Yeah, yeah. And again, with for patients and even for students and even PTs out there as well, just use good resources for research, right?
Yeah.
So Dr. Google, not good research, right? Dr. Google is something that is really nice to look over, like secondary effects for this med, but not necessarily on this treatment. So it's a lot of great resources out there that I try to really encourage patients to go to. So the physicians I work with, just because you want to have good resources. So sometimes, support groups are great in certain ways. You can have support groups that are very negative,
Yeah.
and that's not a good thing either, because you don't need to be listening to all these things. So this cannot be your case at all, right? So just make sure you get good resources where you have a truly valid research information that is going to make help you to make the better decisions. So what good resources for patients do you think will be good ones to educate themselves?
Yeah. So there's a lot of information out there, and there's a lot of information that can be twisted to whatever you want it to be. So I think the best way is to find if you feel comfortable reading research, going to some of those big research journals, PubMed or the Institute for Science, things like that, that you can go through and look at actually reviewed journals that aren't just these one-off articles that are saying whatever you want the article to say. Really, I mean, there's articles out there that say smoking decreases your risk for cancer in the future. So um just really, one, just using common sense when you're reading something. If something doesn't seem like it's lining up, it probably doesn't isn't true. And going to more of those peer reviewed, and just being careful what everything you read on the internet isn't true. So just taking a lot of those things with a grain of salt when you are reading them.
Exactly. Another good resource, is the American Cancer Society. That really usually have really great resources. And not only that, but a lot of these, patients who struggle, like, from the, economic perspective. So many things out there with grants and money and gas money that can be very helpful. And sometimes they can find a lot of those information at the National American Cancer Society. So, okay. Any podcasts or books that you recommend?
Yeah, so that was something I was thinking about when you had sent the questions. I feel like the book that kind of has made one of the biggest impacts on my life is Atomic Habits. Just learning ways to make healthier habits in your life. And I know it has in there 4 goals to kind of make a habit and make a lasting change in your life. So make kind of an obvious, don't make it something super subtle that no one's going to recognize and no one's going to be able to hold you to. Make it something that you actually want to do, not something that's going to be super far off and it's going to be a struggle to get there. Make it easy, like you don't want to make this try to jump into making a habit that's going to take 10 hours a day to do it, when you're not going to do that, you're not going to follow through that. And then make it something that, again, you really want to do and it's going to satisfy you in your life.
Very nice, very nice. Any podcast?
Yeah. So from like the PT side, there's a lot of podcasts out there. One that I listen to a lot is called the PT Pint Cast, which he is a physical therapist up in the New York area, and he brings on people through every different subspecialty, and kind of interviews them, and a lot of students and things as well. So that is one that I recommend for like PTs or PT students. And then as well, like, your podcast is great resources for anyone that is going through any sort of cancer treatment as well.
Right, thank you. How can people find you?
Yeah, it'll be attached at the bottom of the
Yeah,
link
yeah, yeah.
here.
We'll put it on the, yeah.
Yeah, so my email is just my name, so it's kyle.a.schrock at gmail. And then my LinkedIn as well is, I think it's just my name. Maybe has an underscore or a dash in between first and last name, but
Okay, perfect, perfect. Well, what is one question you wish I will have asked you that you will have answered?
oh, I don't know. I know it's something we've talked about, and it's something that's been on my mind more recently too. Is what truly the plan is in the future. And I feel like definitely you have planted that seed of like the oncology population in the future. Again, it's just finding the area and finding where you're able to do that as well. But I've definitely really enjoyed working with this population and really enjoyed seeing just the impact that we're able to make on their life. I feel like it's is much more obvious sometimes with this population than an orthopedic population or
Mhm.
even like a neurologic population. It just takes longer time, but here you can see just those immediate session to session how much improvement someone's making, and just the changes you're making on their life.
That's awesome. Yes, and again, it is such a, I think that oncology becomes more and more popular in our profession just because it's more cancer survivors, right? Because we become clever, physicians and research, and we try to catch it on early so we can really down the stage cancer. And with that means treatments, with that means some secondary effects that can be long last, effects. And then with that, that means that a patient that is going to come to your door, even as an orthopedic patient that comes with shoulder pain, but just had a diagnosis of breast cancer 2 years ago, and perhaps is still having some axillary web syndrome, you know that your head is not going to go just towards your rotator cuff and your impingement. It's going to go towards like, oh, I know where this is coming from, right? And if that patient never have the opportunity to have PT, because unfortunately, not every institutions have physical therapy for these patients. So then other tools in your toolbox to do to kind of help them out. So definitely just really bringing another knowledge that, you now know how to address it. Like I remember before I was doing oncology, as you know, I did orthopedics for many years, and how many patients I saw that they have a history of cancer. And I'm like, okay, well, you're not active anymore. You're okay. So I totally just kind of like dished that out because I didn't know what else to look for.
Yeah.
And then, yeah, I treat them. And then how many of them I look back now and say, man, I missed so many things I could help with that I didn't know any better, right? Because I didn't know any of the stuff I know now. So definitely bring a different tool that you can use in the future, because I think that even, in the area of orthopedics, all these patients are going to come back to you. You're going to have the patient who has back pain because perhaps they have metastasis on the spine. And what are you going to do with that, right? Most of the PTs who that have no background in oncology, they're just going to freak out and they're like, I'm not touching you, right? I'm just going to show you some base stability. And they're so afraid to do something beyond that because they don't know any better. So again, I think that having that seed on everyone out there is because we're going to need more PTs who knows what to do with these patients, because it's a patient that is going to continue growing as, like I said before, we have more cancer survivors. So, but Kyle, you did a great job here. We're going to miss you. I know we're going to continue being in touch. And I always love to hear from my students when they're out there, and as my colleagues to hear their journeys. And it's so great to hear, like I have still hearing from I just literally hear from this student about from like maybe 4 or 5 years ago, and she wanted to try to do something with oncology in the home health to improve that. And it is awesome. And I love for they still reaching out to me even, 7, 8 years later, like, guess what I'm doing now? I'm now working on this institution when I want to develop the same program you develop at UF. Can you help me? How can I start? So I'm always here to try to really promote that, because, more and more people needs, PTs like us who knows what to do with this type of disease. So again, I appreciate all your work here, and you did amazing. So I will miss you, and thank you for doing this podcast with me.
Yeah. Thank you.
All right. You take care, okay?
You too.
Bye.